Good evening. It's Friday, March 20th. Thanks for joining us tonight. I'm Maya Trabulsi. Stay at home, stay safe, stay healthy. Easy words to hear, but for some, harder to live by as the number of COVID-19 cases in the county, state, and nation are on the rise. KPBS reporter Priya Sridhar breaks down Governor Newsom's stay-at-home order and what it means for California's 40 million residents.
Friday morning, a line had formed outside of the Trader Joe's grocery store near San Diego State University. While most students have left campus and classes have all gone online due to the coronavirus, nearby residents still came to the grocery store with mixed emotions about Governor Newsom's stay-at-home order.
It's very hard because it brings in law and order, but also it jeopardizes your privacy and your free will and personhood, First Amendment right.
Newsom says the order was necessary to try to curb projections that as many as 56% of the state's population, or 22 million Californians, could get coronavirus in the next 8 weeks.
This is not a permanent state. This is a moment in time. And we will meet this moment together, and we will look back at these kinds of decisions as pivotal decisions. If we're to be criticized at this moment, let us be criticized for taking this moment seriously.
The order asks most residents to stay at home. Exceptions can be made for trips to the grocery store, gas stations, food banks, convenience stores, banks, and laundromats, and to get takeout and delivery from restaurants. And of course, any trip to a healthcare provider is also okay. San Diego police say they won't be stopping people and asking them where they're going. It's up to everyone to work together to follow the order.
We're going to do the best we can to educate those businesses, but I think it takes a social pressure. It takes a community to make sure that we survive this. And, if someone sees a business open and that person's got a Facebook page or Instagram page, put it out there. Put it on Instagram and put the pressure. I think if the community puts the pressure on themselves to make sure that everything works out, it actually works out better. So I encourage that.
Other states issued similar stay-at-home orders Friday. No word yet on how long this will last. Priya Sridhar, KPBS News.
The order also says that essential workers can continue to go to work. To find a full list of what jobs are considered essential, visit our website, kpbs.org. Today, San Diego City and county officials tried to bring more clarity to the governor's order while updating other efforts to fight the virus. KPBS reporter Matt Hoffman live in the newsroom with those details. Matt, what can you tell us?
Maya, yeah, but first, moments ago, San Diego Mayor Kevin Faulconer, he just spoke about the border closure and what this will mean for San Diego.
The new border crossing limitations go into effect at 9 p.m. tonight for the next 30 days, unless otherwise extended. I spoke on the phone this afternoon with Customs and Border Protection Director of Field Operations here in San Diego, Director Pete Flores, to talk about this decision. And he stressed to me that the critical services and commerce will continue to flow.
Now, we are still waiting for the latest numbers of cases of the virus in our county. So far, 105 cases of COVID-19 have been reported, 25 more cases than the previous update. Now, nearly a dozen San Diegans have been hospitalized with no deaths yet reported. Officials said at a briefing today there are likely more cases here that we simply don't know about.
What we are seeing is the tip of the iceberg, and at a minimum, the number of actual cases that are probably in the community is probably 10 times what we're seeing in terms of what we're reporting.
That's because officials say testing is only reserved for those who are showing severe symptoms.
The current availability of testing is extremely limited.
Health officials are trying not to overwhelm local hospitals.
We are still very concerned about the capacity of our healthcare delivery system.
But they need the public's help.
80%, that's 80% of individuals who get COVID-19 have mild to moderate symptoms. And these individuals can self-isolate and stay home, which means they do not need to go to the doctor.
The county is currently working to purchase additional medical supplies for healthcare providers.
They are getting what they need. So I'm in contact with them. We're turning around the resources and providing them with the personal protective equipment that we have.
This as officials are reiterating Governor Gavin Newsom's mandate for people to stay at home.
Citizens businesses and organizations have stepped up to the plate to do their part. Now I am personally asking you to do more. Please stay at home.
If people take it seriously, officials say the virus's transmission will be slowed and lives will be saved.
If people stay at home, we decrease the risk of exposing others who are not sick. And that is the goal of this stay at home. It's safer to stay at home. That's the goal of that strategy.
Now, today we did also get an update about people from a cruise ship that are currently quarantined at MCAS Miramar. County officials tell us everyone on base will complete their mandatory 2-week quarantine and be sent home sometime next week. We'll send it back to you, Maya.
Thanks so much, Matt. And as the mayor mentioned, tonight the U.S.-Mexico border will close to thousands of non-essential visitors who cross every day. The Trump administration says it's doing so for at least 30 days to help contain the coronavirus pandemic. KPBS reporter Max Rivlin-Nadler has more.
At the San Ysidro port of entry today, people had to make difficult decisions over where to spend the next 30 days, with family and friends in Tijuana or with family and friends in the United States. Some people had to pick up things like dry cleaning that they'd left in the city, and others had to pick up things like their cars.
Mario Oropeza was in a car accident last week. He brought his car down to Tijuana for repairs.
Pretty bad timing. It's very expensive to fix it here. Over there, it's like a third of the price, you know. But I need my car back.
Oropeza had gone down to Tijuana this morning before the shutdown to get his car, but it wasn't ready in time, and now he doesn't know how long he'll be without it. He's worried that he'll lose his job in retail also.
I think we're going to start closing on Monday, so I guess I don't know. I don't know how it's going to affect everything, you know?
While Oropeza might be without a job or car during the pandemic, 22-year-old student Cristina Rodriguez had just a few hours to decide where she wanted to shelter during the unfolding crisis. She left her family in Tijuana and went north, where she was still figuring out where she would be staying.
I think people are just trying to go wherever they need to be during the isolated time. Yeah.
Was this a tough decision?
Yeah, I think so. It's kind of last minute, just trying to decide what needs to be done. But yeah.
None of the people who crossed the border today that KPBS spoke to said that Customs and Border Protection agents were doing anything different today, like checking for symptoms or taking temperatures. Only one person said CBP mentioned the border would be closing for the majority of people. 77-year-old Joe Montione lives in Fullerton and goes down to Mexico to visit his family. He had just spent a week in Tijuana and didn't know the border was shutting down.
No, I haven't heard anything about it. For how long they're going to close it? No, they don't say anything.
Robert Booker from Otay Mesa made sure to get down to Tijuana before the border closes. His reason? His tailor is here, and so are some of his clothes.
I guess it's supposed to begin tonight, if I'm not mistaken.
So that's why you went to get your clothes?
Absolutely. Well, I was planning on getting them today anyway, when I heard the announcement from President Trump that the border may be shutting down today or tonight, this evening. I wanted to make sure I got my clothes.
It's an unprecedented situation along the border. Two cities, essentially together, will now spend the next 30 days or much longer apart. At the border, Max Rivlin-Nadler, KPBS News.
Chula Vista Councilman Steve Padilla's condition has worsened since he tested positive for COVID-19. His daughter released a statement saying Padilla was admitted to UCSD Thornton Hospital ICU yesterday. Padilla announced his positive test last Saturday in a video. Now he is being treated with a respirator to help with difficulty breathing associated with the virus. He asked his daughter to pass on the message that everyone needs to take COVID-19 seriously and to follow the advice of public health professionals to reduce the spread of the virus. San Diego State University study abroad student has tested positive for COVID-19. The university says the student returned directly from Spain to Tulare County, where he or she is self-isolating. Another SDSU student who studied in Italy tested positive for the virus last week. That student is also self-isolating outside of San Diego County, but did briefly return to campus after returning from Italy. San Diego County hospitals will likely be filled beyond capacity in the coming months with patients needing treatment for COVID-19. That's according to an analysis of hospital bed data by Harvard researchers. KPBS reporter Claire Tregesser talked to local hospitals about how they are preparing.
The models from the Harvard Global Health Institute illustrate how many patients would need treatment and how many hospital beds would be available under multiple scenarios. They show that hospitals will be over capacity if 20% of the county's population, between 60,000 and 70,000 people, is infected over 18 months. That is the best case scenario. In the worst case, in which 60% of the population, over 1.8 million people, is infected, there would be 5 times as many patients as available beds. The San Diego region is in worse shape than Los Angeles, Orange County, and Riverside. In each of those regions, hospitals would be able to meet demand in the best case scenario. Under the worst case scenario, hospitals in those regions would be getting 4 times as many patients as available beds. Local hospital systems are already preparing to meet the increased need.
We have been reducing elective procedures, and we have contingency planning in place to expand our critical care beyond normal ICU beds. We're also looking at housing options on campus.
Dr. Christopher Longhurst is the Chief Information Officer at UC San Diego Health. He says they are also boosting virtual visits to keep patients at home if possible. If more staff are needed,
we can extend physicians by bringing in internists who normally work in different specialties.
Claire Tregesser, KPBS News.
San Diego County is still struggling to test large numbers of people for the COVID-19 virus. KPBS reporter Eric Anderson says county officials are hopeful that the situation will change in the coming weeks.
The number of San Diegans who've been tested for the coronavirus is still being counted in the hundreds, not thousands. The county's chief medical officer says tracking how many people are infected is important, but the information has limited value. Dr. Nick Ifantides says the number of positive cases is only the tip of the iceberg.
It is very important for our community to not have a sense of security that because we have 3.3 million people living here, that 80 cases is not that significant. The tip of the iceberg is what we are able to capture, but it is fair for you all to understand that that iceberg is increasing in size under the water.
County public health officials say current rules require a person to be sick and have their doctor request a test, because the number of tests available remains limited. County medical official Eric McDonald says healthy people should not be tested, and if a person is sick but the symptoms are mild, those people should just stay home and care for themselves. McDonald says the county only has a few hundred tests available, and there's a shortage of the chemicals that activate those tests.
We have one hospital that has the kits and the machine, but none of the reagents. And so that is the long pole in the tent, so to speak. We don't have visibility on the commercial laboratories, but we know that because they're prioritizing hospitalized patients only, and that there is a significant delay in getting results, that they must also be having issues with the reagents in addition to perhaps the kits.
McDonald says it may still be a couple of weeks before tests are widely available. Eric Anderson, KPBS News.
We're following all of the latest coronavirus developments for you at kpbs.org. Click on the Tracking COVID-19 link on our homepage, and then you'll be taken to a page with all of our recent reports. You can find that right now at kpbs.org.
I'm Judy Woodruff. Tonight on the NewsHour, new infections surge in the U.S. as everyone in California and New York is ordered to stay at home. Coming up at 7 after Evening Edition on KPBS.
While we're all being told to stay at home, a little rain might not seem so bad, but we could get a break this weekend, giving you a chance to take that much-needed walk outside. Marvin Gomez has our forecast.
We did have a little bit of wet weather last night. As a matter of fact, as of this Friday morning, here are some of the 24-hour totals that we collected. Notice some spots do have a few hundredths of an inch, but there are some other locations, such as San Clemente, where we had pretty much 4/10 of an inch of rain. Now, as we take a look at some of your weather highlights here for you, we do have that onshore flow that will continue in the next couple of hours, and we still see the possibility of showers at times. As we head into your Saturday morning, there also will be some mountain snow and some isolated high peaks could get up to a coating of an inch. Temperatures will continue below average as we head into the next couple of days. And looking at the radar and satellite, just mostly cloudy skies so far. In the last couple of hours, a couple of sprinkles have been in Southern California, but overall, we're just dealing with mostly cloudy conditions as we head into tonight. There is a very slight chance, again, of those showers around, which could give us another 1/10 or 2/10 of an inch of rain. Your temperatures across Ramona will be dropping to 45 degrees, 52 tonight in Borrego Springs, Chula Vista, 52 degrees. Now, as we head into your Saturday, overall, just a tranquil weather pattern across most of California and the entire south coast here throughout the state. And looking at your temperatures for tomorrow, the clouds we're going to have tonight will be lifting. We're going to have opportunities for sunshine tomorrow afternoon. Mount Laguna coming up to 47 degrees. Ramona, 62. Oceanside near 65 degrees. There is another low pressure system that's going to be coming our way as we head into your Sunday. So Sunday afternoon, parts of the coast in California are going to get some showers. But for the most part here across our area, we're going to have a mix of sun and clouds. But Sunday night through your Wednesday afternoon, there will be more opportunities for wet weather for most of California. And of course, here at home, we will see perhaps some showers, especially heading towards your Wednesday across the coast. Temperatures are going to be in the 60s for the next couple of days. Meanwhile, inland areas, perhaps a shower in the morning hours across our Monday across inland areas again. And for the mountains, well, it is going to be a little bit breezy for parts of the weekend. 49 degrees for your high on Sunday, 47 for your Monday afternoon. And the deserts, well, we are in the 70s here for the next couple of days. For KPBS News, I'm AccuWeather's Marvin Gomez.
The transition from military to civilian life can be one of many challenges. The Foundation for Women Warriors is an organization that helps meet the unique needs of thousands of female veterans. This year, the foundation is celebrating 100 years of service to women. And on this day, the 17th anniversary of the Iraq War, I talked with the foundation's executive director, Jody Grenier. Jody, welcome. Thank you so much for being here today.
Thank you so much for having me.
Now, March 20th. I'm sure you remember this date. It's the anniversary of the U.S. invasion of Iraq. It's a really important time to talk about the experiences, individual experiences of our troops, you being one of them, serving in the Marine Corps for 5 years. You were only 19 years old at the time. Tell us about what that experience was for you as a woman in the military.
As an intelligence analyst, my job was to collect information on where enemy threats were and brief unit commanders. At 19, 20 years old, that was quite a significant job that I had. I was one of maybe 3 women in a team of over 300 Marines. So I think my experience as a woman at that time, reflecting back on, I can see some differences. But at the time, I was a Marine and had a job to do.
And then after 5 years of serving in the Marine Corps, you left. What was it like in terms of feeling supported as now a veteran, as a woman veteran?
So I left the Marine Corps in 2005 after I did 2 deployments, and I found myself back home in Connecticut. And at the time, there weren't the resources that we now have today for our veterans, and so I kind of just had to navigate the transition on my own. I was met initially by a lot of bias and a little bit of misogyny around me being a woman and had served. Having curly hair, being petite, these are things that society wasn't quite ready to associate with a stereotypical veteran. Yeah. And then, of course, me finding other women that had the same experiences as I did. I served with so few women in the military. I think at the time it was 5%, now it's 9%. I didn't fall into a sisterhood.
And is that the sisterhood that you feel that you wanted to create for female veterans?
Absolutely. Today, in my role as CEO of Foundation for Women Warriors, we really focus on providing a cohesive support network for women veterans. A lot of that was born out of my own personal experience of not having that.
What do you want people to know about the needs of women?
Right, so women veterans are the fastest growing segment of veterans, but they are also the fastest growing segment of homeless veterans. You have women that are mothers, they're afraid to report themselves as being homeless because they're afraid to have their children removed from them. So a lot of what our organization does is interjects or meets these women at their critical area of need and provides either housing stipends, childcare to keep them in work or in school, and then also workshops to enhance their employability.
Without the Foundation for Women Warriors, would these women still be forgotten and underserved?
We're the only organization in the country providing childcare assistance. I think there's other organizations, but they don't solely focus on women's experience and putting women in the same room as other women who have similar experiences.
Thank you so much, Jody Grenier from the Foundation for Women Warriors.
Thank you so much for having me.
Stocks ended lower at today's closing bell. It was the worst weekly performance for all three major stock indexes since October of 2008. The Dow closed 913 points lower, dropping 17.3% this week. The index was now erased all of the gains from the Trump administration. As businesses around the country are being forced to close, Goldman Sachs is predicting more than 2 million people will file for unemployment this week. That's the highest number on record. We spoke with Miro Kopik from SDSU and Bottom Line Marketing.
I wish I had really good news. Unemployment has been at historic lows at 3.5%. We're going to see that unemployment rate spike to 6 or 7% come April the 1st. The peak of the 2008 financial crisis, there were 650,000 weekly claims being filed. We're approaching that right now with only a third of the states reporting. What we're going to watch for over the next week is there's a couple of indicators. Hopefully some of the larger market swings are behind us. We're going to see what kind of package is being passed by the Senate to support businesses, to support large industries like travel, and then what's going to happen to consumers who are going to be in their homes and not receiving a paycheck in large parts of the economy.
Students and former students saddled with debt will get a break from paying off their loans. President Trump has directed the Secretary of Education to tell federal lenders to allow borrowers to suspend their student loans and loan payments without penalty for the next 60 days. The Trump administration is also temporarily waiving all interest and federal student loans. Borrowers are being told to contact their lenders for more details. Americans are getting an extra 3 months to file their taxes amid the coronavirus pandemic. Today, the Treasury Secretary announced tax day is being moved from April 15th to July 15th. However, if you are expecting a refund, you're encouraged to file as soon as possible to get your money back. The new deadline applies only to federal tax income payments. For state taxes here in California, you have until June 15th to file and pay. The San Diego Blood Bank says the local blood supply is at a critically low level. It's calling on anyone who is healthy and hasn't been exposed to coronavirus to donate. You can go to sandiegobloodbank.org or you can call 619-400-8251. The blood bank says there is no risk of getting coronavirus through blood donations. A teacher in Santee found a creative way to stay in touch with her students while they're away from school.
I was huffing and puffing and sneezing and making a real scene.
No, that's silly.
That's silly. It was a paper bag.
Sarah Lathers is filming herself reading stories to her 2-year-old daughter Harper and then posting it online. The first grade teacher at Sycamore Canyon Elementary says putting story time online is her way of letting her students know she's thinking about them.
I think because I care so much about their education and them as people, and I just want to know that they're somewhere feeling comfortable and safe amidst all the chaos as well. How we react is how they will react, and we just need to make sure we're drawing them into our calm and not contributing to any chaos.
And you can find the videos on Lathers' YouTube channel, which she calls Stories with Squishy. We want to remind you about a partnership between KPBS and the San Diego Unified School District. It's called At Home Learning, where children matter. Just by turning on the TV to KPBS2 or any of the channels on your screen right now, students can watch PBS content designed by their grade level on a block schedule. Grades pre-K through 3rd grade can watch from 6 to 8 a.m., grades 4 through 8 can watch from 8 to 1 p.m., and high school content will be on from 1 to 6 p.m. There's also an online library that can be accessed on any smartphone, tablet, or computer at pbslearningmedia.org. An update now on our top story. We're still waiting for the latest number of cases of the virus in our county. As of yesterday, there were 105 total cases of COVID-19. Today was the first day of Governor Newsom's order for all Californians to stay at home. Exceptions can be made for trips to the grocery store, to gas stations, food banks, convenience stores, banks, and laundromats, or to seek medical care. San Diego police say they will not be stopping people and asking them where they're going. It's up to everyone to follow the order. We're adjusting our programming this weekend. KPBS Roundtable will not air. In its place will be a special edition of KPBS News. COVID-19 in San Diego will air tonight at 8:30, Saturday at 5:30. It will be a showcase of how KPBS has covered the story this week. You'll also find it at kpbs.org and the KPBS YouTube channel. And of course, you can find tonight's stories on our website, kpbs.org/evening edition. I'm Maya Trabulsi. From all of us here at KPBS, stay safe. Good night.